The U.S. and the world mark and mourn a milestone in the coronavirus pandemic. A total of 1 million lives around the globe have been lost to COVID-19, the disease caused by the new coronavirus. Now, the virus began spreading like wildfire 6 months ago, a pandemic of people, pain, and sadly, politics. And it comes as the world marks another important moment, the 75th anniversary of the United Nations. Today, UN Secretary General Antonio Guterres lamented that the pandemic has revealed humanity's shortest of shortcomings, our unwillingness to work together and to help each other. 1 million dead are 1 million too many. But just as the author Ernest Hemingway conveys in his book, it is the value of human life which we must remember when we are reminded for whom those bells toll. Here in Europe, the most dire warning came today from the UK.
As the disease spreads, as it spreads across age groups, we expect to see increase in hospitalizations, and unfortunately, those increase in hospitalizations will lead to an increase in deaths. The epidemic is doubling roughly every 7 days. And you can see that by mid-October, if that continued, you would end up with something like 50,000 cases in the middle of October per day.
Yeah, disturbing numbers there. To talk about that, let's cross to Carlisle in the UK. I want to bring in Dr. John Campbell. Dr. Campbell works as an independent health analyst. He has generated a sizable following on social media. Dr. Campbell, it's good to have you back on the day.
Thank you, Brent.
Let's talk about these numbers. The UK's top health advisors say that the virus is in general circulation, doubling every 7 days. And then there is this other number, 50,000 cases per day by next month if nothing is done. I mean, these are sobering figures.
But they are very high figures. I mean, the official increase in cases today was just about 4,500 in the UK, but that was the officially tested cases that have been formally diagnosed. The Office for National Statistics is currently saying about 6,000 new cases per day, but that means about 70,000 people suffering from the condition at the moment today in the United Kingdom. But the COVID symptom tracker app with the Tim Spector and Zoe group is probably the most accurate, and that shows over 10,000 new cases today and nearly 100,000 people who are actually ill as we are today. And as you rightly say, we've got a doubling time of 7 to 8 days. Now, I think that figure of 50,000 new cases per day, Patrick Vallance was keen to point out that that was what could happen. It's not a projection, it's a possibility. He's pointing out a risk, he's pointing out a danger. And of course, our job is to make sure that doesn't happen because it doesn't get to those kind of levels. Because if it did, a month later, that would transpire into about 200 deaths per day.
And with all of that, you've got Prime Minister Boris Johnson due to address the nation tomorrow. Do you think there is pressure on him to announce a complete lockdown?
No, I don't really think that's going to happen. Now, people are talking about the possibility of a circuit breaker. And a circuit breaker is this idea of a short, sharp shock where you would have a lockdown, but only for about 2 weeks. But I think there's a few reasons why that probably won't be announced. It takes at least three weeks for the effects to feed through, so you wouldn't know if it was working. And for that to be effective, you'd have to be locked down for about twice as long as you were unlocked. So you'd be in this alternating cycle of short, sharp shocks, of circuit breakers alternating with normal periods of time. And we're looking at about the next 6 months of that. So I don't think that's going to happen. But we are getting this exponential rise for now. The cases are doubling regularly. So I think we could see increased fines for breaches. I think it's possible we'll see more rules on masks and more strict enforcement of mask wearing. I think there'll be targeted interventions where he targets geographical groups and targets particular types of behaviour that are known to be infection drivers. There's a COBRA meeting tomorrow. They're going to decide this. There's probably going to be more public education. One of the infection drivers in the UK has been late night drinking. So I'm pretty sure that tomorrow we're going to see a 10 p.m. curfew on pubs. Pubs will be closed at 10 p.m. The risk there, of course, is people will go home from the pub and carry on drinking at home.
Yeah.
We could see further restrictions on the hospitality industry as well. I don't think schools and universities are going to be affected yet.
Where are we going, Dr. Campbell? I mean, we've got winter just around the corner, for the UK, for the United States, as well as for us here in Germany. What does that mean? Does it mean, in your opinion, that we've got harder times coming for us?
The simple answer to that, Brett, is absolutely yes. We know that all respiratory viruses spread more in the winter. People get cold noses, so their infection is reduced. People go inside and shut the windows, so there's more viral load in the air. People don't go out and get as much sunshine, so there's less vitamin D circulating in the blood. And all these things can contribute towards spread of infection. There's also the possibility of influenza, although we've got a very active influenza program going at the moment. But the next 6 months are going to be critical. The Chief Medical Officer today said we've turned a corner. And really, we've got a fork in the road now. We can decide which way to go. One way is that we could have this exponential rise with cases doubling. The other way is we can get on top of this virus and keep it managed over winter. But whatever happens, we are going to have to be taking all of the measures that we're taking now for at least the next 6 months. Now, I believe a vaccine is coming, and I believe that vaccine will be effective. And I think it's quite possible that a few key workers could be vaccinated in December 2020. But most people are not going to get this vaccine till 2021. So we've got this winter to get over. And it's this seasonal effect, this seasonal increase in risk as we shut the doors, as we reduce the ventilation, as we turn on the heating, that we're going to get increased transmission.
Dr. Campbell, I've got about a minute left. I want to ask you about this case of a man in Delaware being reinfected after having recovered from COVID-19 back in March. What does this tell us about the virus's ability to mutate, and what does that mean for a vaccine?
Good question. The virus does mutate, but it tends to mutate fairly slowly. It's not a fast mutating virus like an influenza virus, for example. In terms of the vaccine, the people that are making the vaccine are aware of the parts of the virus that can mutate quickly, and they've actually targeted parts of the virus which are likely to mutate slowly. And they've also targeted several parts of the virus. So even if one part does mutate, they should still be able to get the vaccine working on the other part. In terms of reinfection, yes, there are definite documented cases of reinfection, but very, very few, only about half a dozen around the world that have definitely been documented. So people can become reinfected, but this is going to be the vast minority of cases. And the people that are reinfected don't get sick. They just test positive so far from the cases I've known. So I believe that when people have been infected with this disease, they do have a fairly high degree of immunity. We don't know for how long. Right. But I suspect, given that SARS coronavirus 1 showed long-term immunity in some cases, this is likely to as well. I'm hopeful for that.
Okay. Dr. John Campbell, as always, Dr. Campbell, we appreciate your time and your valuable insights tonight. Thank you.
Thank you.
Well, now to France, which reported a new record high this weekend with over 13,000 new COVID cases in 24 hours. The government wants to avoid returning to full lockdown and instead is banking on physical distancing and other measures to keep public life from taking over. Now, for students returning to the university, the restrictions come with their own challenge, as DW's Lisa Lewis reports.
It's a start of term like no other at this university in a suburb north of Paris. Despite the strict anti-COVID measures, these economics students are happy to be here. It's nice to be back at university. This just shows that, despite the virus, life continues. Our university has done what's needed to adapt to the situation. We are split into 2 groups and have online classes every second week. Every second seat is off limits, and we have to wear masks, although that's a bit of a nuisance. Quite a contrast to a holiday season during which many people lowered their guard. Most of France's recent COVID cases are amongst young people. Many of us travel during the summer. After all, the virus is less severe for us young. And if many need to get it to build up herd immunity, the young should get it. The government has only given basic guidelines to the universities. Each institution has had to come up with its own detailed plan.
On a le port du masque, la distanciation.
Ours includes masks, social distancing, online classes, and we have forbidden student parties. Because of these measures, we won't have to shut down if students test positive for COVID, because there are no contact persons, at least at university.
Nous pouvons continuer à faire court puisqu'il n'y a pas de cas de contact.
But the number of infections has been rising across France. More than half of the country has now been declared a red zone, with at least 50 new daily infections per 100,000 people, compared to just a dozen in neighbouring Germany. Local governments can impose additional measures in these zones, like temporarily closing bars and restaurants. And yet, social distancing and locally adapted strategies won't be enough to prevent another lockdown, says this virologist. France doesn't even have a testing strategy, for example, to test those who work with vulnerable people, such as the elderly. The only way to control the epidemic is to systematically track down and isolate infected people. For that, we need to come up with a national strategy, use the most simple testing methods, such as self-testing and group testing, and we need to test massively. Despite the challenge the country faces, these students hope the economy will stay open. They'd like to continue to enjoy Parisian cafe terraces where the risk of infection is lower. This is like a little patch of paradise. We can meet our friends here without masks and have a drink. We need to stay united in these hard times. It's important to stay in touch and form social bonds, even if it's just through meeting up in small groups. It's not certain this pleasure will last for very long, though. The country's strategy does allow for local lockdowns, and Paris has one of the highest infection rates in the country.
And here's a look now at some of the developments in the coronavirus pandemic. The U.S. public health body, the CDC, has withdrawn guidance saying that fine aerosol particles floating in the air may spread the virus. The retraction has sparked concern of political interference. Mexico has passed 700,000 confirmed coronavirus cases, but officials say that the overall infection rate is still slowing down. And New Zealand recorded 0 new COVID-19 infections on Tuesday. There are now only 61 registered active cases in the country.